Let me ask you a question. Have you been dealing with some kind of foot pain or knee pain or hip pain or something like that? You've been to the podiatrist, you've been to the physiotherapist, you've been to the chiropractor, and they're doing some stuff there, but they can't quite figure out what's going on and wondering, why does this still hurt? Well, I want to pose the possibility for you that maybe the problem is actually coming from your neck. Hi, I'm Dr. Jeffrey Hanna from Atlas Health Australia, and in this video I want to show you the relationship that the alignment of your head and your neck have and how that can actually influence problems down at your knee and down at your foot. So in particular, as a bit of background, what I am is what's called an upper cervical chiropractor. This is a person whose focus is on the alignment of the bones in the upper neck because of how this affects your brainstem and your nerve system, which are ultimately the master control systems of your body. And if you've had these kinds of injuries there, it doesn't always cause pain at the site of injury. And what your brain will do is it will cause the rest of your body to shift and to compensate. So I've done a few other videos that will try to link in with this one here, but in brief, you can think of it this way: where your head goes, your body goes. And I've got this fun little poster right behind me that illustrates this interesting phenomenon that will happen with people, is that if you've got a little misalignment in through your neck here, it can cause the center of gravity of your head to shift, but rather than this going wonky, it's going to cause your shoulders to tip certain ways. It's going to cause your back to tip certain ways, and this is actually going to manifest as asymmetrical muscle tightness that can go all the way down into your hips, your knees, and even down into your feet. And this is present whether you're standing up, whether you're lying down, whether you're sitting down, that tension is there. So it can oftentimes feel like one side of my body feels tighter than the other. Or I get these injuries and they always seem to happen on one side of my body. Well, it could very well be is because that's related to the overload scenario, just like this. Now, what does this have to do with your knee pain here? It's because if you are up, standing, walking, running around, jogging, all of those different kinds of things there, and you're doing it on these tight muscles, the tight muscles on one side versus the other can actually cause the hip to hike kind of like this. And then relatively speaking, your legs are like this. And you can see that if you were to lie face down on a bed to see if your ankles are actually even. Most likely, it's not that your feet are different lengths, is that you have this asymmetrical muscle tightness producing the illusion of the legs being crooked. And as I had said, this is also present when you are standing up. Now, typically speaking, these kinds of imbalances, if it's under 3 millimeters, your body can usually compensate pretty good. However, if these issues start to exceed that, so 5 millimeters, 8 millimeters, a centimeter or beyond, then we're talking about things that are 2, 3, 4, 5 times over the normal limit for your body to compensate for. And then it's really only a matter of time for these muscles, which were designed to compensate for these things to a certain extent, but not for the long time. They will eventually start to give and to give way. And when they just can't take it anymore, then you've got the pain, the issues, the bursitis, the capsulitis, the swelling, the inflammation, the aches, the pains, the stiffness that just are not going away. And if then you're trying to do the treatment focusing on the hip, on the knee, and on the foot, but it's just not going away, then very likely it's because it's the weak spot, but compensating for something else. And I want to raise the possibility that it is coming from right up here. So what I want to show you now is I want to show you a way that you can actually have a look to get some kind of an idea if you might have an issue in your neck that could actually be at least in part related to what you have going on in your knees and down in your feet. Now, this is not meant to diagnose any kinds of conditions or anything like that. This is a video. That would be silly. But it's to give you some kind of an idea, at least of the possibilities of what you may actually have going on. So, firstly, keep in mind as we're looking at the poster here that if you have the tightness occurring on one side, what will very often happen is your body will also shift its weight to that side. And if, for example, you had a couple of scales and you could check your balance, normally average person should be the same plus or minus 1 kilo on either side. But if you're seeing a deviation in that, it means that there's more stress and pressure built up on that one side. In other words, there's more weight and more weight, then you can test this even if you don't have the two scales by having a look at your shoes. And in particular, what I'm going to tell you is you are looking for an uneven wear pattern. So all shoes are going to have a relatively finite period of time, but if you're looking at the bottom of them, and these are not my shoes, these are my wife's shoes, that the bottom of them should wear out the same on either side, assuming you don't have other kinds of ankle injuries and all this sort of stuff that are really, really significant. But if you've got an uneven wear pattern, and I'm going to show you the example right here, that can be the indication that you're dealing with something like this coming from the top down. Now, it does not need to be the entire bottom of the shoe. It needs only be one particular spot. And so the reason I've picked these among her shoes is because they have the striations on the bottom here, where what I want to do is I want to illustrate for you, we'll get it really close to the camera, I'll try to keep my face a little farther back, that this is the relatively normal one here on the bottom where you can see relatively even. But I want to draw to your attention this spot right through here and the uneven wear that's occurred on the outside of that heel. So this is something even in my own wife that I need to look and I need to check to make sure that her neck is properly aligned, because what we have found for her is that the more misaligned her own neck is, the more pronounced this is, and the quicker she's going to run out through her shoes. So what you can do for your own self is go into your closet, grab the shoes, grab multiple pairs of shoes if you want to compare these things, and you're looking for stuff like that where there's uneven wear. Maybe it's on the outside, maybe it's at some point on the bottom or on the outside, or maybe it's on the inside. It really could be anywhere. And truth be it is that all it takes is for one tiny part of your shoe to be worn through for it to be a problem. So for example, let's say, and this was oftentimes the case with my wife's running shoes for years and years, she would wear out this one particular spot and the entire rest of the shoe was still just fine. But because that was where the extra stress in her strike spot was, that when that spot was worn out, even though the rest of the shoe was fine, it was no longer any good for her. And the result of that, and I think all runners will know this, is that when your shoes are toast, all of the extra stress and that force is going to go directly into your feet, your knees, your ankles, your hips, your low back, and all that sort of stuff, and that you had to change your shoes over. Now, if your shoes are not the problem, then again, that's the whole point here, is that maybe there's something else that is going on. So I hope this little video gives you a little bit more information about why you might be having some persistent kinds of issues. And it's not to say that, oh, there's definitely an issue in your neck going on, but just simply giving you something else to consider, that maybe the reason that you're getting these different kinds of aches and pains and maybe not finding the answers you're looking for is because you need to look at a different part altogether. Hopefully you've enjoyed this video. If you found value in it, we'd like you to please, number one, like this. We'd also encourage you to subscribe to our different channels that we have through Facebook, YouTube, Instagram, and also check out our website, which is atlashealth.com.au, where you can find all kinds of additional articles and information about the particular kind of work that we do and how we may be able to help you out. This is Dr. Jeffrey Hanna at Atlas Health Australia, a passion and purpose for helping people live a better quality of life.